Experts agree that an early diagnosis is a crucial element in effectively coping with Alzheimer's disease. Sufferers who receive early diagnosis have the time to create strategies to deal with their illness. Fortunately, there are a number of Alzheimer's tests that individuals can take to determine if they are suffering from the disease. First, a physician or nurse will administer a physical examination and go over a person's medical history. Medical history is important during Alzheimer's testing because those with a history of psychiatric or emotional problems are at greater risk for developing the disease. Doctors must also rule out other medical problems to make sure that there isn't an underlying cause for dementia. Underlying conditions that can cause dementia include brain tumors, anemia, chronic infections, severe depression, thyroid disease, strokes and vitamin deficiency. In some cases, the patient might just be severely depressed. Symptoms of depression in elderly persons can mimic Alzheimer's. For example, someone with depression may have trouble concentrating and may also experience more forgetfulness than usual. These symptoms are similar to what an Alzheimer's sufferer would experience. Also, it's common for seniors to believe that symptoms are just the result of old age because many Alzheimer's symptoms can be easily confused with that of aging. Another test used to diagnose Alzheimer's is a neurological exam and mental status examination. Typically, MRI or CAT scan of the brain is usually performed as well. However, if Alzheimer's is in the early stages, a brain scan may turn out normal in later stages. The size of different areas of the brain may decrease, leading physicians to believe that Alzheimer's is present. The patient may also be sent to several specialists including a neurologist, psychologist, and psychiatrist. A psychiatrist will examine the individual's mood and determine the emotional health of the patient. The neurologist checks for diseases of the brain and nervous system, and the psychologist will typically administer memory tests and gauge other mental functions. It's also important to remember that there is no single test that determines if a person has Alzheimer's disease. The diagnosis must be confirmed by a series of tests and evaluations. Alzheimer's can only be diagnosed by a complete medical assessment. Early diagnosis is incredibly important. It gives the patient a chance to benefit from treatment that could prevent or stall the progression of the disease. It also affords the sufferer more time to plan for the future. Additionally, individuals with Alzheimer's may have an increased chance of participating in clinical drug trials that could benefit them, or at least further research. Furthermore, patients who know they are in the early stages of Alzheimer's can begin to obtain the emotional support that they need to cope with the disease. Early prevention can make a stark difference in a sufferer's life, and people with symptoms of Alzheimer's should immediately obtain an evaluation by a physician.